A deadly surge of COVID-19 began in India in April, overwhelming hospitals, morgues, and crematoriums. The second wave saw people die due to oxygen shortages, while others perished waiting for treatment outside full hospitals. But now, as India has seen a slight decrease in numbers, death and destruction headed its way in the form of Black Fungus and Cyclone Tauktae. India set a global record for the number of COVID-19 deaths reported in one day, breaking a record previously held by the USA. 4,529 deaths were recorded on May 18, 2021, the highest any country has registered in one day over the course of the pandemic. India has seen a total number of 25.8 million cases from the start of the pandemic, with more than 283,000 deaths. The number of new daily coronavirus cases has started to fall, but now India is facing another deadly disease. Amid a surge in COVID-19 infections and deaths, surgeons are reporting an increase in the number of Black Fungus cases in patients who survived COVID-19. This is a rare fungal infection that is caused by exposure to mucor mold, which is found in soil, plants, and even the mucus of healthy people. It affects the sinuses, the brain, and the lungs, and can be life-threatening in diabetics or people with weakened immune systems.
The immune system weakens after recovering from COVID-19. The patients who had diabetes, who were on steroids during COVID treatment for a long time, or who were admitted to ICUs, this black fungus is detected in them due to their weak immunity.
While the country has not yet released the total number of people infected with the disease, 2 states in India have declared the black fungus an epidemic. It has a 50% mortality rate and requires all infected tissues to be removed for patients to have a fighting chance.
My sister-in-law recovered from COVID-19. Her result came back negative, and after 3-4 days, she had a headache and said she couldn't see anything. We took her to a nearby hospital in the Junagadh area, but the doctor said her treatment was impossible there and asked us to come to Rajkot. The doctors in Rajkot said the fungus is spreading very fast and she needs an operation.
Unfortunately, this has resulted in some patients losing an eye or parts of their nasal tissue. On top of this, on May 14, 2021, a powerful cyclone hit India, hampering efforts to slow down COVID-19 infections. Gujarat, already one of the regions hardest hit by the coronavirus pandemic, was in the firing line again as the cyclone uprooted trees and destroyed homes and crops. Cyclone Tauktae has forced tens of thousands of residents to evacuate. The number of fatalities has jumped to at least 91 as a result of drowning, houses collapsing, and lightning strikes. The storm has caused more than 2,435 villages to lose power. Outages have affected 100 out of the 400 COVID-19 hospitals in Gujarat and has forced vaccination efforts to be suspended.